Ellie, there are patients who come to us post-op. Obviously, they come for their first follow-up, and or we're seeing them post-op in the wards. A question that every patient will ask us eventually, obviously, is when can we start getting back to our activities? When can we start physio or exercises, and what we can do?
Yeah.
And it's easy for us as surgeons to say, we'll refer you to the physios.
Yeah.
But in terms of your point of view, what would you like to say about this?
Yeah. So it's great, isn't it? Everybody wants a time scale.
Yeah.
Everybody loves to know, when can I do that, and am I doing it before or after the Mrs. Jones sat next to me in the ward? The truth of the matter is it's individual, and that every single person will hit timescales at different points. Much like children will reach developmental stages at different points, you'll reach rehab goals at different stages. And all that's really dependent on the type of surgery you've had, the maybe physical fitness level you came into the surgery with, and your short or long-term goals after the surgery. So the best way to answer that is to sit down with somebody, put all those things together into the mix, and then discuss where we're going to aim for. And they will never be pinpoint timescales. It will never be by week 1, by week 2. It will always be when you feel ready and when your body allows you to. So much of what we discuss is about actually tuning into the body. We've mentioned hurt doesn't mean harm. We've mentioned desensitization. All those things come into the mix so that you can tune in and listen to what your body's telling you. And actually, for me, that's what leads to success with any of our rehab goals.
That's it. It's great that patients understand this, because that way they don't have like a closed mind, or they don't go in with certain fixed ideologies like, oh, she did it in one day, I need to do it. If I'm not doing it, I'm wrong.
Yeah.
So it's important for them to understand that yes, you can delineate certain exercises or goals for particular forms of surgery, but there's no particular time frame in which they need to get into a particular routine or whatever, but it depends on how they can manage.
Yeah, I think it's important that there's no guilt or failure to attach to if you don't meet the targets when you think you're going to meet them. It's an evolving, developing process, and that's really what we want to get across, is that everybody has their own timescales and own agenda, and it's about you, not anybody else.
Yeah, no, that's very well said. Do you think on a broader scale we can though outline certain exercises that, without a time frame, that patients can use to build up, condition themselves before they actually get into proper sort of formats of physio or exercise or rehab?
So absolutely, going back to listening to your body, if we start with one exercise, we can tune into when that exercise feels easy and comfortable, then your body naturally is going to want the next challenge. So we then progress it. So again, it's listening to when things become easy, you need the next challenge, then we push you that bit further. And that's all about stepping up in terms of developing your strength and control. Yeah,
I think what would be really nice is if we can outline a sort of, I don't know, plan of exercises maybe that patients can, you know, sort of view and pick out from, which make them feel comfortable. And maybe then also try and split up which exercises are better for which conditions or which surgeries. And I think patients or viewers will benefit a lot from that. What do you think?
Yeah, I think so. And I think that's where we're going to start, is to show you a few really simple exercises you can try at home. And as we talk through them, let you sort of key into those things about you, listen to your body and what to watch out for.
Oh, that sounds great. I think that will really help all our viewers.
Good, I hope so.
Yeah, great.